Teeth and Gum, Chapter 6, Personal Care Skills. Learning Objective 1. Explain personal care of residents. Personal care is different from other tasks that NAs may perform for residents, such as measuring vital signs or tidying a unit. The term personal refers to tasks that are concerned with the person's body, appearance, and hygiene. It suggests privacy may be important. Hygiene is the term used to describe ways to keep bodies clean and healthy. Bathing and brushing teeth are two examples. Grooming refers to practices like caring for fingernails and hair. Hygiene and grooming activities, as well as dressing, eating, transferring, and eliminating, are called activities of daily living, ADLs. NAs will help residents with these tasks every day. These activities are often called AM care or PM care. This refers to the time of day that they are done. Assisting with AM care includes offering a bedpan or urinal, or helping the resident to the bathroom, and helping with perineal care as needed. Helping the resident wash face and hands. Assisting with hair care, dressing, and shaving. Assisting with mouth care before or after breakfast. Assisting with PM care includes offering a bedpan or urinal, or helping the resident to the bathroom. Helping the resident wash face and hands. Giving a snack. Assisting with mouth care. Assisting with changing into night clothes. Giving a back rub. The way NAs help residents with personal care plays a large part in promoting residents' independence and dignity. The help NAs give will be different for each resident. It will depend on each resident's abilities. For example, a resident who has recently had a stroke may need more help than one who has a broken foot that is almost healed. Promoting independence is an important part of care. Many people have been doing personal care tasks for themselves their entire lives. They may feel uncomfortable about having anyone help them with these tasks. Some residents may not like to be touched by someone else. NAs must be sensitive to these issues. They should be professional when helping with these tasks. Before beginning any task, the NA should explain to the resident exactly what she will be doing. Having care explained is a resident's legal right. It may also help lessen anxiety. The NA should ask the resident if he would like to use the bathroom or bedpan first. She should provide privacy by pulling the privacy curtain around the bed and closing the door. The resident should be allowed to make as many decisions as possible about when, where, and how a procedure is done. This promotes independence and is part of providing person-centered care. Other ways for NAs to promote respect, dignity, and privacy include the following. Encouraging residents to do as much as they are able to do and be patient. Knocking and waiting for permission to enter the resident's room if the resident is able to give permission. Not interrupting residents while they are in the bathroom. Leaving the room when residents receive or make phone calls. Respecting residents' private time and personal things. Not interrupting residents while they are dressing. Keeping residents covered whenever possible when helping with dressing. Figure 6-1, Caption. Nursing assistants should let the resident make as many decisions as possible about personal care. During personal care, the NA should look for any problems or changes that have occurred. Communication is very important during personal care. Some residents will share symptoms, feelings, and concerns with the NA. The NA should keep a small notepad in a pocket to note exactly how the resident describes these symptoms. These comments should be reported to the nurse and documented. NAs must also look for physical or mental changes. The resident's environment should be checked for anything unsafe. These issues should also be reported. During the procedure, if the resident appears tired, the NA should stop and take a short break. The resident should not be rushed. After care, the NA should always ask if the resident would like anything else. She should leave the resident's area clean and tidy. Before leaving, the NA must make sure the call light is left within the resident's reach. The room should be at a comfortable temperature. The walkways must be clear. The bed should be left in its lowest position unless the care plan instructs otherwise. Observing and reporting. Personal care. Skin color, temperature, redness. Mobility. Flexibility. Comfort level or pain or discomfort. Strength and the ability to perform ADLs. Mental and emotional state. Residents' complaints. Learning Objective 2. Identify guidelines for providing skin care and preventing pressure injuries. Immobility reduces the amount of blood that circulates to the skin. Residents who have restricted mobility are at greater risk of skin deterioration at pressure points. Pressure points are areas of the body that bear much of its weight. Pressure points are mainly located at bony prominences. Bony prominences are areas of the body where the bone lies close to the skin. The skin here is at a much higher risk for skin breakdown. These areas include elbows, shoulder blades, the tailbone, hips and knees, inner and outer parts, ankles, heels, toes, and the back of the head. Other areas at risk are the ears, the area under the breasts or scrotum, the area between the folds of the buttocks or abdomen, and the skin between the legs. Figure 6-2. Caption. Pressure injury danger zones. Pressure on these areas reduces circulation, decreasing the amount of oxygen the cells receive. Warmth and moisture also add to skin breakdown. Once the surface of the skin is weakened, injuries can occur and may become infected. This can cause damage to the underlying tissue. When infection occurs, the healing process slows. The injuries that result from skin deterioration and shearing are called pressure injuries, also called pressure ulcers, pressure sores, decubitus ulcers, or bed sores. Shearing is rubbing or friction that results from the skin moving one way and the bone underneath it remaining fixed or moving in the opposite direction. If caught early, a break in the skin can heal fairly quickly without other problems. However, if not caught early, a pressure injury can get bigger, deeper, and infected. Pressure injuries are painful and are difficult to heal. They can lead to life-threatening infections. Prevention is important. It is the key to skin health. Stages of pressure injuries are: Stage 1. Skin is intact, but it may look red, and the redness is not relieved after removing pressure. Darker skin may not look red, but may appear to be a different color than the surrounding area. The area may be swollen, painful, firm, soft, or warmer or cooler when compared to the area around it. Stage 2. There is partial thickness skin loss involving the outer and/or inner layers of skin. The injury is pink or red and moist, and may also look like a blister. Stage 3. There is full thickness skin loss in which fat is visible in the injury. Slough and/or eschar may be present. Slough is yellow, tan, gray, green, or brown tissue that is usually moist. Eschar is dead tissue that is hard or soft in texture and black, brown, or tan, and may be similar to a scab. The damage may extend down to, but not through, the tissue that covers muscle. Stage 4. There is full thickness skin loss extending through all layers of the skin, tissue, muscle, bone, and other structures such as tendons. The injury will look like a deep crater, and slough and/or eschar may be visible. Unstageable pressure injury. There is full thickness skin and tissue loss, but the extent of the damage cannot be determined because it is covered with slough or eschar. Once the slough and/or eschar is removed, the injury can then be staged, either stage 3 or stage 4. Deep tissue pressure injury. The skin area is intact or non-intact and is deep red, purple, or maroon. The wound may appear as a blood-filled blister. The area may be painful and may be warmer or cooler than the surrounding tissue. Discoloration may be different in darker skin. Figure 6-3. Caption. Pressure injury stages as described by the National Pressure Ulcer Advisory Panel, NPUAP. A. Photo of a stage 1 pressure injury on the buttocks. B. Photo of a stage 2 pressure injury on the buttocks. C. Photo of a stage 3 pressure injury on the heel. D. Photo of a stage 4 pressure injury on the foot. Photos copyright National Pressure Ulcer Advisory Panel, npuap.org, used with permission. Observing and reporting. Resident skin. Report any of these to the nurse. Pale, white, reddened, gray, or purple skin. Blisters, bruises, or wounds on the skin. Differences in temperature of the skin when compared to the area around it. Complaints of tingling, warmth, or burning of the skin. Dry, cracked, or flaking skin. Itching or scratching. Rash or any skin discoloration. Swelling. Fluid or blood draining from the skin. Broken skin anywhere on the body, including between the toes or around the toenails. Changes in existing injury. Size, depth, drainage, color, or odor. Breaks in the skin can cause serious, even life-threatening problems. It is better to prevent skin problems and keep the skin healthy than it is to treat problems after they happen. Guidelines. Basic skin care. Report any changes in the resident's skin. Provide regular, daily care for skin to keep it clean and dry. Check the skin daily, even when complete baths are not given or taken every day. Reposition immobile residents often, at least every 2 hours. Give frequent, thorough skin care as often as needed for residents who are incontinent. Change clothing and linens often as well. Check on residents at least every 2 hours. Do not scratch or irritate the skin in any way. Keep rough, scratchy fabrics away from the resident's skin. Report to the nurse if a resident wears shoes that cause blisters. Massage the skin often. Use light, circular strokes to increase circulation. Do not massage bony areas. Do not massage a white, red, or purple area or put any pressure on it. Massage the healthy skin and tissue around the area. Be gentle during transfers. Avoid pulling or tearing fragile skin. Residents who are overweight may have poor circulation and extra folds of skin. Pay careful attention to the skin under the folds. Keep it clean and dry. Report signs of skin irritation. Encourage well-balanced meals and plenty of fluids. Proper nutrition is important for keeping skin healthy. Keep plastic or rubber materials from coming into contact with the resident's skin. These materials prevent air from circulating, which causes the skin to sweat. Follow the care plan. It may include instructions about special skincare, such as washing the skin with a special soap. For residents who are not mobile or cannot change positions easily, do the following. Keep the bottom bed sheet tight and free of wrinkles. Keep the bed free from crumbs. Keep clothing or gowns free of wrinkles too. Do not pull the resident across the sheets during transfers or repositioning. This causes shearing, which can lead to skin breakdown. Place an absorbent bed pad under the back and buttocks to absorb moisture that may build up. This also protects the skin from irritating bed linens. Absorbent pads are also available for wheelchairs. Relieve pressure under bony prominences. Use pillows and other devices to keep elbows and heels from resting on the surface of the bed. Figure 6-4, Caption. This foam boot suspends the heel to help reduce pressure. Copyright Medline Industries Incorporated. A bed or chair can be made softer with flotation cushions or special foam overlays. Use a bed cradle to keep top sheets from rubbing the resident's skin. Residents in chairs or wheelchairs need to be repositioned often too. Reposition residents at least every hour if they are in a wheelchair or chair and cannot change positions easily. Many positioning devices are available to help make residents safer and more comfortable. Guidelines. Positioning devices. Backrests provide support. They can be regular pillows or special wedge-shaped foam pillows. Bed cradles or foot cradles are used to keep the bed covers from resting on a resident's legs and feet. Draw sheets may be placed under residents who cannot help with turning, lifting, or moving up in bed. Draw sheets help prevent skin damage from shearing. A regular bed sheet folded in half can be used as a draw sheet. Footboards are padded boards placed against the resident's feet to keep them properly aligned. They help prevent foot drop. Foot drop is a weakness of muscles in the feet and ankles that causes problems with the ability to flex the ankles and walk normally. Foot splints may also be used to help prevent foot drop. Footboards are used to keep bed covers off the feet. Rolled blankets or pillows can also be used as footboards. Hand rolls are cloth-covered or rubber items that keep the hand and or fingers in a normal, natural position. A rolled washcloth, gauze bandage, or rubber ball placed inside the palm may be used to keep the hand in a natural position. Hand rolls can help prevent finger, hand, or wrist contractures. Figure 6-5, Caption. Hand rolls keep the fingers and hand in a natural position, helping to prevent contractures. Reprinted with permission of Tidy Products, LLC. An orthotic device, or orthosis, is a device that helps support and align a limb and improve its functioning. It may be prescribed to keep a resident's joints in the correct position. Orthoses also help prevent or correct deformities. Splints are a type of orthotic device. Splints in the skin area around them should be cleaned at least once daily and as needed. Do not apply a splint unless you have been trained in its use. Figure 6-6, Caption. Different types of orthotic splints. Photos courtesy of North Coast Medical Incorporated, www.ncmedical.com, 800-821-9319. Trochanter rolls are rolled towels or blankets used to keep a resident's hips and legs from turning outward. Abduction pillows, wedges, splints, pads, or hip wedges keep hips in the proper position after hip surgery. Pillows between the legs from knees to ankles while in the lateral position can help keep the spine, hips, and knees in the proper position. Learning Objective 3. Describe guidelines for assisting with bathing. Bathing promotes health and well-being. It removes perspiration, dirt, oil, and dead skin cells from the skin. It helps to prevent skin irritation and body odor. Bathing can also be relaxing. The bed bath is an excellent time for moving arms and legs. It increases circulation. Bathing gives NAs an opportunity to observe resident skin carefully. Residents may have a bath in bed, or they may take a shower or have a tub bath. They may have a partial bath, which is a bath given on days when a complete bed bath, tub bath, or shower is not done. It includes washing the face, hands, axilla, underarms, and perineum. The perineum is the genital and anal area. Guidelines. Bathing. The face, hands, underarms, and perineum should be washed every day. A complete bath can be taken every other day or less often. Older skin produces less perspiration and oil. Elderly people with dry, fragile skin should bathe only once or twice a week. This prevents further dryness. Be gentle with the skin when bathing residents. Use only products approved by the facility or that the resident prefers. Before bathing a resident, make sure the room is warm enough. Be familiar with available safety and assistive devices. Gather supplies before giving a bath so the resident is not left alone. Before bathing, make sure the water temperature is safe and comfortable. Test the water temperature with a thermometer or against the inside of your wrist to make sure it is not too hot. Then have the resident test the water temperature. The resident is best able to choose a comfortable water temperature. Wear gloves while bathing a resident and change your gloves before performing perineal care. Make sure all soap is removed from the skin before completing the bath. Keep a record of the bathing schedule for each resident. Follow the care plan. Procedure: giving a complete bed bath. Equipment needed: bath blanket, bath basin, soap, bath thermometer if available, 2 to 4 washcloths, 2 to 4 bath towels, disposable absorbent pads, clean clothes, 2 pairs of gloves, orange wood stick, lotion, deodorant, brush or comb. When bathing, move the resident's body gently and naturally. Avoid force and overextension of limbs and joints. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Identifying resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to the resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for residents' privacy with curtain, screen, or door. Be sure the room is at a comfortable temperature and there are no drafts. Maintains residents' right to privacy and dignity. 5. Adjust bed to a safe level, usually waist high. Lock bed wheels. Prevents injury to you and to resident. 6. Place a bath blanket or towel over the resident. Ask him to hold on to it as you remove or fold back the top bedding to the foot of the bed. Remove top clothing while keeping resident covered with the bath blanket. Place clothing in proper container. Figure 6-7. Caption: cover the resident with a bath blanket or towel before removing the top bedding. 7. Fill the basin with warm water. Test water temperature with a thermometer or against the inside of your wrist. Water temperature should be no higher than 105 degrees Fahrenheit. Have resident check water temperature to see if it is comfortable. Adjust if necessary. The water will cool quickly. Change the water when it becomes too cool, soapy, or dirty. Resident's sense of touch may be different than yours. Therefore, resident is best able to identify a comfortable water temperature. 8. Put on gloves. Protects you from contact with body fluids. 9. Ask the resident to participate in washing. Help him do this when needed. Promotes independence. 10. Uncover only one part of the body at a time. Place a towel or absorbent pad under the part being washed. Promotes resident's dignity and right to privacy. Also helps keep resident warm. A towel or pad under the body part helps keep the bed dry. 11. Wash, rinse, and dry one part of the body at a time. Start at the head, work down, and complete the front first. When washing, use a clean area of the washcloth for each stroke. Eyes, face, ears, and neck. With a wet washcloth, no soap, begin with the eye farther away from you. Wash inner to outer area. Use a different area of the washcloth for each stroke. Repeat for the other eye. Wash the face from the middle outward. Use firm but gentle strokes. Wash the ears and behind the ears. Wash the neck. Rinse and pat dry. Figure 6-8. Caption: first wash the far eye from the inner to outer area, using a different area of the washcloth for each stroke. Arms and axilla. Begin with the arm farther away from you. Remove the arm from under the towel. With a soapy washcloth, wash the upper arm and underarm. Use long strokes from the shoulder down to the wrist. Rinse and pat dry. Repeat for the other arm. Figure 6-9. Caption: support the wrist while washing the shoulder, arm, underarm, and elbow. Hands. Wash the far hand, including the fingers and fingernails. Clean under the nails with an orange wood stick. Rinse and pat dry. Make sure to dry between the fingers. Give nail care. See procedure later in this chapter. Repeat for the other hand. Put lotion on the resident's elbows and hands. Chest. Place the towel across the resident's chest. Pull the blanket down to the waist. Lift the towel only enough to wash the chest. Rinse it and pat dry. For a female resident, wash, rinse, and dry breasts and under breasts. Check the skin in this area for signs of irritation. Abdomen. Keep towel across chest. Fold the blanket down so that it still covers the pubic area. Wash the abdomen, rinse, and pat dry. If the resident has an ostomy, give skincare around the opening, Chapter 4. Cover with the towel. Pull the cotton blanket up to the resident's chin. Remove the towel. Legs and feet. Expose the far leg. Place a towel under it. Wash the thigh. Use long, downward strokes. Rinse and pat dry. Do the same from the knee to the ankle. Figure 6-10. Caption. Use long, downward strokes when washing the legs. Place another towel under the far foot. Move the basin to the towel. Place the foot into the basin. Wash the foot and between the toes. Rinse the foot and pat dry. Make sure the area between the toes is dry. Apply lotion to the foot if ordered, especially at the heels. Do not apply lotion between the toes. Repeat steps for the other leg and foot. Figure 6-11. Caption. Washing the feet includes cleaning between the toes. Back. Help resident move to the center of the bed. Raise the far side rail if used for safety. Help the resident to turn onto his side toward the raised side rail. Return to the working side of the bed. His back should be facing you. Fold the blanket away from the back. Place a towel lengthwise next to the back. Wash the back and neck with long, downward strokes. Rinse and pat dry. Apply lotion if ordered. Figure 6-12. Caption. Wash the back with long, downward strokes. 12. Place the towel under the buttocks and upper thighs. Help the resident turn onto his back. If the resident is able to wash his perineal area, place a basin of clean, warm water, a washcloth, and a towel within reach. Hand items to the resident as needed. If the resident wants you to leave the room, remove and discard gloves. Wash your hands. Leave side rails up if used. Return bed to its lowest position. Leave supplies and the call light within reach. 13. If the resident cannot perform perineal care, you will do so. Remove and discard your gloves. Wash your hands and put on clean gloves. Provide privacy at all times. 14. Perineal area and buttocks. Change the bath water. Place a towel or pad under the perineal area, including the buttocks. Wash, rinse, and dry perineal area. Work from front to back, clean to dirty. Expose the perineal area only. For a female resident, using water and a small amount of soap, wash the perineum from front to back. Use single strokes. Use a clean area of washcloth or a clean washcloth for each stroke. Figure 6-13. Caption. Always work from front to back when performing perineal care. This helps prevent infection. Working from front to back, wipe one side of the labia majora, the outside folds of perineal skin that protect the urinary meatus and the vaginal opening. Then wipe the other side using a clean part of the washcloth. With your thumb and forefinger, gently separate the labia majora. Wipe from front to back on one side with a clean washcloth using a single stroke. Using a clean area of the washcloth, wipe from front to back on the other side. Using another clean area of the washcloth, wipe from front to back down the center. Clean the perineum, area between the vagina and anus, last with a front to back motion. Rinse the area thoroughly in the same way. Make sure all soap is removed. With a clean, dry towel or washcloth, dry entire perineal area. Move from front to back using a blotting motion. Ask the resident to turn on her side. Using a clean washcloth, wash and rinse buttocks and anal area. Work from front to back. Clean the anal area without contaminating the perineal area. With a clean, dry towel or washcloth, dry buttocks and anal area. For a male resident, if the resident is uncircumcised, pull back the foreskin first. Gently push the skin toward the base of the penis. Hold the penis by the shaft. Wash in a circular motion from the tip down to the base. Use a clean area of washcloth or clean washcloth for each stroke. Figure 6-14. Caption. Wash the penis in a circular motion from the tip down to the base. Thoroughly rinse the penis and pat dry with a clean, dry towel or washcloth. If the resident is uncircumcised, gently return the foreskin to normal position. Then wash the scrotum and groin. The groin is the area from the pubis, area around the penis and scrotum, to the upper thighs. Rinse and pat dry. Ask the resident to turn on his side. Using a clean washcloth, wash and rinse buttocks and anal area. Work from front to back. Clean the anal area without contaminating the perineal area. With a clean, dry towel or washcloth, dry dry buttocks and anal area. 15. Cover the resident with the blanket. 16. Empty, rinse, and dry bath basin. Place basin in designated dirty supply area or return to storage, depending on facility policy. 17. Place soiled clothing and linens in proper containers. 18. Remove and discard gloves. 19. Wash your hands. 20. Provide deodorant. Place a towel over the pillow and brush or comb the resident's hair. See procedure later in this chapter. Help the resident put on clean clothing. Help the resident into a comfortable position with proper body alignment. 21. Return bed to lowest position. Leave side rails in the ordered position. Remove privacy measures. Lowering the bed provides for safety. 22. Place call light within resident's reach. Allows residents to communicate with staff as necessary. 23. Wash your hands. Provides for infection prevention. 24. Report any changes in resident to the nurse. Provides nurse with information to assess resident. 25. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Back rubs help relax tired muscles, relieve pain, and increase circulation. Back rubs are often given after baths. After giving a back rub, any changes in a resident's skin should be noted. Procedure: giving a back rub. Equipment needed: cotton blanket or towel. Lotion. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for residents' privacy with curtain, screen, or door. Maintains residents' right to privacy and dignity. 5. Adjust bed to a safe level, usually waist high. Lower the head of the bed. Lock bed wheels. Prevents injury to you and to resident. 6. Position the resident lying on his side or his stomach. Cover resident with a blanket or towel. Fold back the bed covers. Expose the back to the top of the buttocks. Back rubs can also be given with the resident sitting up. 7. Warm lotion by putting the bottle in warm water for 5 minutes. Run your hands under warm water. Pour lotion on your hands. Rub them together. Always put lotion on your hands first, rather than on the resident's skin. Increases resident's comfort. 8. Place hands on each side of upper part of the buttocks. Use the full palm of each hand. Make long, smooth, upward strokes with both hands. Move along each side of the spine, up to the shoulders. Circle your hands outward. Move back along outer edges of the back. At the buttocks, make another circle. Move your hands back up to the shoulders. Without taking your hands off the resident's skin, repeat this motion for 3 to 5 minutes. Long upward strokes release muscle tension. Circular strokes increase circulation in muscle areas. Figure 6-15, Caption. Move along each side of the spine up to the shoulders. Figure 6-16, Caption. Long upward strokes help release muscle tension. 9. Knead with the first 2 fingers and thumb of each hand. Place them at the base of the spine. Move upward together along each side of the spine. Apply gentle downward pressure with fingers and thumbs. Follow the same direction as with the long, smooth strokes, circling at the shoulders and buttocks. 10. Gently massage bony areas, spine, shoulder blades, hip bones. Use circular motions of your fingertips. Use little or no pressure. If any of these areas are white, red, or purple, do not massage them. Discoloration indicates that skin is already irritated and fragile. Include this information in your report to the nurse. 11. Let the resident know when you are almost through. Finish with some long, smooth strokes. 12. Dry the back if extra lotion remains on it. 13. Remove blanket or towel. 14. Help the resident get dressed. Help resident into comfortable position. 15. Store supplies. Place soiled clothing and linens in proper containers. 16. Return bed to lowest position. Remove privacy measures. Provides for resident safety. 17. Place call light within resident's reach. Allows resident to communicate with staff as necessary. 18. Wash your hands. Provides for infection prevention. 19. Report any changes in resident to the nurse. Provides nurse with information to assess resident. 20. Document procedure using facility guidelines. If you do not document the care, legally it did not happen. Hair care is an important part of cleanliness. Shampooing the hair removes dirt, bacteria, oils, and other materials from the hair. Residents who can get out of bed may have their hair shampooed in the sink, tub, or shower. For residents who cannot get out of bed, shampoo basins can be used. There are also special types of shampoo that do not require the use of water. Gloves should be worn if a resident has open sores on his scalp. Figure 6-17, Caption. This is a rinse-free shampoo cap that does not require the use of water. Permission granted by Sage Products, LLC. Procedure: shampooing hair in bed. Equipment needed: shampoo, hair conditioner if requested, 2 bath towels, washcloth, bath thermometer, pitcher or handheld shower or sink attachment, waterproof pad, bath blanket, shampoo basin, comb and brush, hair dryer. 1. Identify yourself by name. Identify the resident by name. Resident has right to know identity of his or her caregiver. Addressing resident by name shows respect and establishes correct identification. 2. Wash your hands. Provides for infection prevention. 3. Explain procedure to resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Promotes understanding and independence. 4. Provide for residents' privacy with curtain, screen, or door. Be sure room is at a comfortable temperature and there are no drafts. Maintains residents' right to privacy and dignity. 5. Arrange the supplies within reach. 6. Test water temperature with thermometer or against the inside of your wrist. Water temperature should be no higher than 105 degrees Fahrenheit. Have resident check water temperature. Adjust if necessary. Resident's sense of touch may be different than yours. Therefore, resident is best able to identify a comfortable water temperature. 7. Remove all pillows and place the resident in a flat position. Chapter 7. Chapter 6. Personal care skills.